Dr. Mahajan, it's good to have you on the interview.
I'm very happy to be here with Zambia in Lusaka today.
And should I say welcome to Zambia?
Oh, thank you, thank you. In fact, I'm looking this kind of opportunity to create an awareness and therapies which are of the future for the.
Begin from defining this the living drug. What exactly do you mean by the living drug?
The living drugs is the science of what you can say the molecular science, genomic science, and cells. These are the part of your body which can be used for treating your all most of the diseases, and it is beyond the conventional science. And today, this science is taking up most of the world. It become existing, and now we look forward to create that kind of facility in Lusaka, Zambia.
All right.
At
so,
Sanket.
So, what are the particular diseases that you're actually looking at when you talk about the living drug that could actually maybe just heal on themselves without really using conventional medicines?
Living does a science which communicates with you. These cell molecules are living, they breathe and they talk to your cells in your body. And they can be used for treating all conditions which are not treatable by conventional science, like autoimmune conditions are there, cancers are there, degenerative brain diseases are there, developmental brain diseases are there, metabolic disorder, diabetes, there are arthritis, there are knee joint orthopedic conditions are there. All these of diseases can be well managed, treated without any complications of conventional drugs where we use steroids, immunosuppressants, or bone marrow suppressants. So we don't require to use all these kind of drugs.
All right. So, how common is this kind of remedy in India where you're coming from?
The science in India is coming on a very high way. Rather, I would say it has come to the therapy levels now. This kind of therapies we would like to get from India for academic purpose. We would like to train the doctors here. Even the public masses orientation programs will be taking. And also saying that establish a therapy center, which is a center of excellence with Sanket here at the model center here, where we'll be establishing this facility and looking to develop this facility for almost the subcontinent of Sahara.
Talk about the beauty of this particular remedy. What is the beauty of it?
This is a nice question you asked me. The beauty of it is that this science doesn't operate. No stitches, no sutures, no medications, only using some kind of cells from your own body could be used. I call them as you carry your repairing kits in your body. This new phase of science is that there are no surgeries, no conventional medicines, there are no pharmacological drugs. The cell which is going to work as a medicine for you communicates with your disease cells. That's all by injections, target based. You can do it from your bone marrow, from your fat, from peripheral blood. Of your own can be used to treat the conditions as I said, cancers, immunotherapies, autoimmune diseases, T-regulatory cell therapies. Then you have got orthopedic conditions where you don't require joint replacement to be done. Hip joint and knee joint can be regenerated. So we do repair, regenerate, and recreate the organs back to normal.
Okay. So if I had tumor, how would you treat that particular tumor? Would you like to cut it or perhaps just treat it the way it is?
This therapy works on immunology of your body, particularly cell types which are immune cells, NK cells can be used, T cells can be used, these cells can be used to target the cancer cells, and DC cells, dendritic cells can be used. And we can target those cancer cells and take care of your cancer than going for chemo, radio, or surgical treatments.
Talk about the duration, the time period of treatment, this particular type of treatment for a certain type of disease. How long should it take?
This treatment is called as a personalized customized therapies. Basically depends on the disease what you suffer. Some of the diseases are one-time treatments, some of the diseases you have to maintain in degenerative conditions like Parkinson, Alzheimer, you may have long-term treatments. Whereas in orthopedic conditions, you have 1 or 2 treatments and you're off the line for beautiful life without you don't require replacement of the joints. And diabetes, one-time treatment, and autoimmune disease, maintenance therapies are required, but there are no medications, and it will give a quality of life where otherwise conventional medicine cannot give you.
All right. So are we talking about herbal medicines here in this kind of treatment?
No, there is no herbal medicines in this. This is absolutely cell-based technologies from your own bodies. Particularly, we use your products from your body, like genomic science, you can say, molecular science, you can say. Then you can say cell-based technology, you can say stem cell technology, you can immunotherapies. All these sciences are coming from your own sources of your body.
What could be your concluding remarks, Doctor?
I would say rather, these are going to be a cutting-edge science. These sciences are going to change the future face of medicine. And I expect this kind of science to be in Zambia to give the cure to all those children small which suffer from cerebral palsies, autistic diseases, or old age patients like dementias, Alzheimer's disease, or autoimmune diseases like you can say multiple sclerosis, rheumatoid diseases, ankylosing spondylitis, these kind of diseases where the people are suffering here a lot. And no conventional medicines where you spend $1 billion, but no treatments are there. So I wish this kind of chronic disease, we have a great opportunity to compete with the most advanced countries.
All right, it's been wonderful hosting you, Doctor.
Thank you for giving me a chance to be here with you.